Urinary Part 3. Once urine has been made in the nephrons, the passage of urine goes from the nephrons to the collecting ducts, down to the tips of the renal papilla, and drain into the major and minor calyces, into the renal pelvis, the ureters, urinary bladder, urethra, and finally to the outside world. We can see some of that pathway in this picture. We had seen this picture before, and the kidneys are sitting on top of this region that has picked up dye. We're seeing the minor and the major calyces outlined here going into the renal pelvis, to the ureter, and of course we have it on right and left sides coming to the urinary bladder, which would then drain into the urethra. The ureters enter the posterior inferior border of the bladder. Here we see the opening to the ureters, and in lab you should have learned that the openings of the ureters coming to the urethral opening forms the region of the trigone, which is medically important. This is a region where we sometimes can get infection traveling up into the upper regions of the urinary system. When the bladder is contracting and urine is being forced down into the urethra, the full bladder causes the collapse of the distal ends of the ureter so that you don't get reflux, the flow backward, back and upward, heading back to the kidney, which could be destructive to the kidney. So you don't get urine backflow. The urinary bladder is retroperitoneal. That means it's behind the peritoneal membrane, and it basically lies on the floor of the pelvis, so it's very low in the abdominopelvic cavity. The epithelium that forms the lining of the ureter is a special kind of epithelium called transitional epithelium. It's an epithelium that is very adaptable to the stretch that happens in the urinary bladder and then the relaxation. It's constructed in a way that allows the cells to stretch greatly as the urinary bladder fills and then shrinks back to normal size when the urinary bladder empties. The muscularis layer, the layer of muscle, is called the detrusor muscle, and there's a cycle of expansion and contraction as the bladder fills and then voids, fills and then voids. If we're looking here at a sagittal section, we see the urinary bladder sitting on the pelvic floor. That's true for men and for women. You'll notice that in men, just below the urinary bladder is the prostate gland, which of course is not going to be present in women. One of the major differences is that the urethra coming out of the male is much longer than the urethra coming out of the female, and that shortness of the urethra is the reason why females have a greater tendency to have urinary tract infections, since it isn't a far distance for the infectious agents to travel. One of the things that I want to point out over here is the urethral sphincters. If we look at the base of the bladder, right over here, the muscle in this region forms a sphincter, and this sphincter muscle is involuntary. There's going to be a second urethral sphincter called the external urethral sphincter. The external urethral sphincter is right over here. It's in the wall of the body where we have some skeletal muscle. This is going to be a voluntary sphincter. So normally both sphincters will be closed as the urinary bladder fills. They will go through the reflex that will cause the opening of the internal urethral sphincter, but you will not urinate. Micturition will not occur. Micturition is the fancy word for urinate. It will not occur as long as the skeletal muscle sphincter remains closed, and that's a voluntary sphincter. In the male, the external urethral sphincter is in the same location as in the female. So if we look over here, we see the external urethral sphincter is here in the wall of the body as the urethra extends downward through the body wall into the penis. At that exit point, we have a band of skeletal muscle that will form the sphincter. So here's the external urethral sphincter. The internal urethral sphincter will be in the same way in the base of the bladder itself. Here we see it better for the male: internal urethral sphincter, external urethral sphincter. Smooth muscle, skeletal muscle. So the internal urethral sphincter will be involuntary, that's within the wall of the bladder, while the external urethral sphincter is where the urethra passes through the skeletal muscle region of the body wall. Here's a comparison of the female urethra versus the male urethra. Again, a difference in length. We have a micturition reflex. It's a reflex that will cause the contraction of the bladder. When the bladder wall is stretched, this reflex is going to be initiated. It goes to the sacral region of the spinal cord. That's where this reflex is coordinated. It's a parasympathetic response, and the detrusor muscle is going to contract as a result of the stretching of the bladder. That causes the internal urethral sphincter to open, but the external urethral sphincter will stay closed because that's under voluntary control. You usually have to relax that sphincter in order to be able to urinate. It's a conscious decision. So if we look at the process, it starts with a stretch. That sends a message to the sacral region of the spinal cord. These are the afferent fibers carrying sensory information to the sacrum. The sacral region will then send a parasympathetic message back to the urinary bladder wall, where it will cause the urinary bladder wall to contract, and that contraction will cause the opening of the internal urethral sphincter, but until you relax the external urethral sphincter, the actual urination will not occur. So this needs to be relaxed as well to allow the urine to pass out of the body. In infants, the kidneys don't concentrate urine as well as in older children, and therefore the urine of infants is quite dilute, and they have frequent micturition. The control of that voluntary urethral sphincter develops with the nervous system, meaning that even though you commonly see children first being toilet trained at the age of about 3 or maybe even older, truth of the matter is they do have voluntary control over the external urethral sphincter at around the time that they begin to walk, because the nervous system is developing in that region around the time that you begin to walk. Most urinary tract infections are E. coli. About 80% are E. coli infections. And one of the things that can irritate the urinary passageways is some of the sexually transmitted diseases. List of lifespan changes. You can read those, see all the good things that await you as you get older.